It is evolutionary for human survival. We are pessimistic. Our brains are wired to do so. So if cavemen settled and became complacent, I think they would die in one way or another. And so the main thing is actually that our circumstances have changed and we don't experience the same kind of threat. But actually, at this point in time, this day and age, being a pessimist is actually likely to work against us. So it's having our brains wired and focusing on exclusively negative things, having a threat mechanism that is always on. Interestingly, according to Dr. Seligman, half of the word is on the low positive affective spectrum, and there is a biological predisposition. But obviously, our experiences, our attachments, our personality factors all contribute on our views of the word. And actually, that these experiences will shape how we see the word in a more positive or more negative way. Yes, there is definitely a biological predisposition with a lot of people being predisposed to being on the negative, pessimistic affective spectrum. And actually is our experiences that actually shape how we are able to see the word. So we have to combine predisposition, so what we bring into the word, with actually our experiences of the word. They are able to shape us. But the issue is when we continue to see the glass half empty, and we are likely to engage in distorted ways of seeing the word. If we expect the worst, we are unlikely to take our chances. And the less chances we take, the less likely we are in succeeding, resulting in a self-fulfilled prophecy. So there is a neurobasis for pessimism, and actually is a combination of the predisposition that we have, that we come into the world with our own nurture and experiences, early experiences, and actually our survival, and actually nowadays our success depends on balancing a spectrum of pessimism and optimism. And therefore, it's not about being on one side or the other side of the spectrum, but actually developing a wider view. Absolutely can affect well-being. And whilst there is a neurobasis for pessimism, we know that actually we're also shaped by nurture and early experiences, and our survival actually depends on balancing a spectrum between pessimism and negativity, and optimism, and actually having hope. So being psychologically flexible is correlated with psychological well-being. We are more robust to deal with life experiences. We are more likely to take our chances and engage in measurable risks when we withhold judgment. But also, we all know that actually when we take our chances, we are more likely to succeed. And actually we can see success as a combination of failures until we learn from each failure until we are able to get it right. And actually having resilience to be able to put up with failure and continue is really important for our mental health and our experiences of ourselves and our self-esteem. So actually, people who have a predisposition to seeing the glass half empty or being pessimistic also have a predisposition to other mental health difficulties. And it's not, you would likely develop into mental health experiences if you have the right triggers. So people with a negative predisposition are wired to develop mental health problems comparably with people without a negative predisposition. So presentations like anxiety disorders, PTSD, depression are examples of mental health disorders that also develop from the way that we see the world and the beliefs that we have about ourselves, the world, and the future. Yes, absolutely. I think the key thing is that psychological support aims to widen our insight of ourselves and others, increase psychological flexibility and our ability very much to look at options rather than engage in a default position settling for the worst case scenario. It also equips us to deal with daily challenges and increase our resilience and coping. And actually, therefore, it increases our quality of life, our relationships to ourselves and others. And so it's really about providing people with tools, with strategies to help them better navigate daily challenges and self-regulate. It enables people to understand how to be able to sit with difficult emotions without having to engage in actions and appease them and dissociate. Knowing that emotions are not permanent, they come and go. Whilst many people seek treatment for very specific conditions, and other people actually look for psychological support to help them to fulfill their life potential. And so there is a variety, but actually one thing that we know is that psychological support would improve self-awareness and insight and enable us to feel empowered to live our best lives, accepting and making peace with elements where we are unable to change or control. So it's up to the individual to establish at what point they feel the need for support. As we know, there is quite a lot of evidence base for treatment for different presenting problems. And obviously the treatment protocols will guide us to specific models or ways of working with patients. But actually, whilst approaches like cognitive behavior therapy and other therapeutic frameworks are very important, I think the key thing is that psychologists are able to do is engaging client-centered approaches. It's about understanding personal preferences, utilizing a range of psychological tools which would be available to better match the needs and preferences of our patients. And I think another key thing is recognizing that therapist and client relationship, trust and engagement is key for recovery. So it's working together with goals set by clients, and we support them to climb the mountain. We don't climb the mountain for them. There is evidence base for psychological treatment across psychological presentations and mental health disorders. But actually the main thing is recognizing that there are lots of different evidence-based frameworks like cognitive behavior therapy. But actually, as psychologists, we are informed by clients. It's about recognizing that we don't work with a one-size-fits-all. It's important to understand what is the evidence, but also develop a conceptualization of clients' difficulties with them and recognize what is important in terms of enabling them to engage in this journey and actually working with their personal preferences whilst utilizing a range of different tools to enable them to self-manage their difficulties. So actually, I think when you have a really positive client-patient relationship, patients become experts in themselves, and they are able to navigate from actually working with a psychologist to eventually self-managing. They are able to internalize the psychologist. And models are nothing but tools that we enable people to work with and utilize. There are a range of strategies. And actually, we are really guided by patients' needs, and we respond when we are constantly reviewing and reformulating our ways of working to actually better meet their needs.